digital dispatches, our 25th edition, believe it or not. And today we'll have Ella Jameson from the Encompass programme to talk to us about the work that's been ongoing with what is notionally known as the patient portal and all the design work that's been going on in the background to get that module delivered. And she's ably assisted today by Brian Roth, Graham Waring and Kate Hollingsworth. So they will ably support Ella whenever we start to fire our questions through. There are a bit of a presentation to begin with, and it will be recorded. So I know it's a glorious day today and some people might be otherwise engaged. So please do feel free to direct them to that. It will be available in a week or so's time. So without further ado, Ella, I'm going to hand over to you and you can kick off our session this afternoon.
Okay, thank you, Linda. And thank you everyone for coming along today. We're going to talk a bit about MyCare, which is the patient-facing element of the Encompass solution that we're putting in across health and social care, across all the 5 trusts. I've been with Encompass really from the early days, but the colleagues that Linda introduced there are way more expert than me in the actual MyCare portal and the journey so far. There's been a lot of discussions about this throughout the various groups that Encompass has set up for decision making. So this is really like a high level overview of where we are at the moment, but it is a bit of a journey that we are on with this. It's a really exciting element of the ethics solution that we're implementing, and it truly is integrated throughout the system. So this isn't a bolt-on or an extra. It is going to enable like really quite fundamental changes in the way that patients eventually are able to interact with the service. So I'm very excited about it. It's probably worth saying up front, there is a lot of nerves about it as well. You know, operationalizing some of this is going to be an additional change challenge for our colleagues in trust. So that's the tightrope that we're walking with the MyCare portal. Okay, so as I said, we'll give a quick overview of some of the key pieces of functionality of MyCare. And we're also going to talk a bit about what we've been doing. And when I say we, mostly Brian, Kate and Graham with the Encompass Engagement Council, which is made up of patients, service users and carers. And is sort of increasingly strongly voicing their feelings around the development of MyCare and other aspects of the programme as well. So you'll notice that we are referring to MyCare. That is the name that after a lot of deliberation we will be using, and we'll be branding it MyCare. You will also hear the term MyChart because that's the Epic product name. Just worth bearing in mind, we do like to have Encompass, Epic, MyChart, MyCare, but hopefully you'll all understand what we're talking about. So what we're going to try to communicate is what this is going to mean as part of this fully integrated health and social care record. As I've mentioned, and I can't drive home enough, it is fully integrated. It isn't bolt-on. It comes natively in different platforms, so it will work on your laptop and through a web browser. It will also work on this mobile app that you can download. And it really is going to be such an enabler for service change. The basic functionality is described here. So as you would hope, there is a health summary that will be viewable. People will be able to see their past conditions, diagnoses, medications that are being reconciled in secondary care and community. They'll be able to see their future appointments, past appointments. After every visit, as you'll probably be aware, there is the practice of producing letters, and those will be available within the MyChart portal. And a new product which we're not really able to produce at the moment, but an after-visit summary will be produced using information that has been captured during the patient encounter. So if you've been up for an outpatient appointment, in very patient-friendly language, it will tell you just what you were there for, what were the main decisions, and what are the next steps. And I know that I'm an absolutely dreadful historian, and as soon as I leave that sort of room, I forget what was talked about. So I think that's something that would be really appreciated. Potential to view test results, we'll talk about that a bit more later. And obviously it's provide a central platform for linking to trusted health information resources and platforms like our patient feedback platform, patient experience platform. So when our staff in the trust are documenting, they're using the same software, they're using the same databases at the back end. So it truly is creating that single patient record. And there's really very little delay then in most of the information being available to the patient to view as well. As a member of the Northern Irish public, how are you going to be able to get access? There's an app that you'll be able to download. It's already there in the App Stores and Google Play. The login process is going to be very similar to the ones that we probably all went through for the COVID certificate and the COVID app. And it's utilising the Northern Ireland Direct sort of tried and tested infrastructure for ID assurance. We get questions about how to manage who can access MyCare, and it's just something we want to stress is that we're not foisting this on everyone. So if you're not comfortable having a patient portal, you don't have to activate it, you don't have to have it. We are keeping all of the channels of communication that currently exist open and available. You can still get letters, you can record your preferences. So hopefully we're about to move more to more emails, but as I say, it's really up to the individual, to the patient, whether or not they want to utilize it. And hopefully it will allow those who can to do, and those who can't to have more of that interaction with the people in our service. There's going to be a sort of soft launch. We talk about a soft launch as each trust goes live with Encompass. So South Eastern Trust's go live date is 9th November this year. And so there will be information available for the South Eastern Trust population that this is available, but we won't be aggressively pushing it out at first. One of the reasons is that, and it is restricted to our trust information. And I think to go on a big bang launch, a lot of people will be looking for information from their GP practices, and that obviously won't be in there. It's also something, I think, from the experience that Epic brings, and people like Kate, who we're fortunate to have working with us, it works really well when it's the individual clinical teams really working with their patients to identify the best use cases, and that sort of being promoted almost organically from the service to the people that they're looking after. Okay, so to give a quick look at the MyCare features, and I will say at this point that we do have links to some YouTube resources. A lot of stuff is available there, but you need to be Googling MyChart, and you would need to be looking, bearing in mind that there are decisions that Northern Ireland are making about where our starting point is going to be with this. But there is lots out there if you want to sort of have a closer look at the portal. We have a patient here called Beth, and we're going to see how she gets on. So this is the view that you would get looking through the web browser. Beth signed up, she's logged on, she's done all her identity assurance using Northern Ireland Direct. And there's quite a simple welcome screen, correspondence, appointments, recent results, and key members of her care team if she's currently undergoing care in the trust. And once all the trusts are live, this will be one place, so it doesn't matter. You don't have to sort of sign up 5 times. It is one portal for across Northern Ireland. So you'll see there just base information, past conditions, medications, allergies. There is potentially the ability to report your own health issues, but these are some of the finer details which are still being worked through in one of our task and finish groups. upcoming visits and information there about the appointment. You'll see an e-check-in button. Again, that is a potential piece of functionality, which would allow the sort of information that is filled in or given maybe at the outpatient desk when somebody arrives today for a clinic to be done in advance using the portal. We talk here, and Epic would use the language a lot about questionnaires, and I think we are all very familiar with going to use services and being handed the clipboard and the 4-page booklet to tick the boxes and fill in the information, and at which point somebody then in the trust probably has to enter a lot of that into one of our various underlying IT systems that we use at the moment to provide care. So there's a great opportunity just to streamline that for the patient and for our staff in using things like pre-op questionnaires would be really one of the big uses for this. So the patient is giving the information once, it's being captured once, and then can be used to provide more streamlined care. And again, you see these little clickable buttons to view the after visit summary that has been associated with any past visits. And there's a little sneak preview. I'm not sure all of our clinicians have agreed to have their best headshots included yet in the after visit summary. I think Mr. Novak is on the call somewhere I saw earlier. Well, that's still up for discussion, and how recent it needs to be as well. I don't know. And test result release. This is something that causes quite a lot of discussion about appropriate release of results. There are different options in the system. There can be a delay put in releasing results. Certain results can be marked to never be released if there is concern about patients receiving them before there has been that clinical discussion with the care team. And again, the finer details of all of that is the topic of top consideration in the task and finish groups. So that was a flying overview. The works in progress, and as I've mentioned, a few things are being, debated with our professional leads, with the involvement of our patients and service users in these task and finish groups. Mention the results release. There's also messaging features, which we're looking at very carefully. They're very powerful, and I would hope in time that they would be used widely as another channel for patients to be able to communicate with the service. But there's also quite a lot of fear and trepidation about the degree of change and resource that would be required to operationalize those. So it's probably likely that those will be rolled out gradually, and decisions will be made on a sort of user group basis or specialty basis. There's some immediate use cases that would spring to mind. So the whole continuity of midwife carer model that's being rolled out, where pregnant woman has a team of midwives already with that relationship, where they may want to be able to message. There will be use cases like that will be the starting point, but it's really important to know that all of these possibilities are there for the future. And it can't be said often enough that turning on the different bits of my chart will be a journey. What we go with on day one is not where we will likely end up. Another topic of debate is suddenly we're going to need to provide support and almost help desk functionality for our patients and service users. Currently, all our help desks are focused on us as health and social care staff. There's a debate about where it should sit. Should that be something separate from what we traditionally see as an IT help desk? Should it be per trust? Should it be regionalized? That's all TBD. And also the whole communication strategy I've mentioned. We are talking about a soft launch There are other pressures where we are being pushed to tell more and more people about MyCare. So that, and my colleague Paul Kelly is comms lead, and he's on here, and he is going to help us work through all of that along with our business change team. And really, trust operational leadership will have a large say in what direction they want to take this. Okay, I don't know, I see there's a few questions in the chat, and we're going to have time for questions at the end, but I'll maybe just push on through to just update you about the Encompass Engagement Council. So this has been stood up, first met early this year. It's supported very much by the Patient and Client Council in recruiting members for this. And as I said, my colleagues, Brian, Graham, and Kate in particular, have really worked hard to operationalize this council to make sure that they were empowered to take part in the decisions that were being brought to them. They meet monthly. They don't hold back, I think it would be fair to say. And they also do provide membership to some of the other key governance groups in Encompass. So yes, so they do have a seat on like the program board and the Information Governance Advisory Council, for example. Examples then of the recent Engagement Council topics that were brought to them, and they provided very honest and robust feedback on plans for the user assurance testing. We are moving the next few months into a sort of end user assurance testing phase of the program in preparation for the go live. And there's I think, a strong appetite, it would be fair to say, for there to be similar user assurance testing, the MyCare portal. They provide a great input into the MySat assessment framework and the way that that's going to look once it's operationalized and Encompass. Epic Care Link, they have been given an overview of that and an understanding of what that is. And for anyone on the call who isn't aware, and I know there are so many multiple terms, Epic Care Link is almost like the NIECR version, the clinical and care professional facing portal. So that will give some of our colleagues who are not directly employed or directly working in the trusts that view into the Encompass record. They've been asked to look in detail at different features of MyCare, and they're also very good and astute at advising on patient confidentiality issues. So that's where they are seeded throughout the Encompass program and helping to guide us along at quite a high level, and certainly handling the tasks very well. So program board, Information Governance Advisory Council, and then we also have a communication work group for our external stakeholders, and they're providing input into that. And just finally, as I mentioned, there are some portal examples, YouTube links, and for those of you who are health and social care employees, you can sign up for Epic user web accounts, and there's infinite more material on there if you really want to dig in and have a look. But I am going to stop sharing so I can see people and see what's going on. And hand back over to Linda. Linda, I have, yeah, there you go. You're on.
There's been quite a few questions have been answered on your behalf just as we were going through there. So you had an able backup team there.
Yeah, I don't go anywhere without them, Linda.
So you didn't even break a sweat having to answer some of those. Has anybody else any other? Oh, there's loads more coming through now. On the chat. I have one question that has been brought up to me on numerous occasions around accessibility. And I'm sure it will be flushed out during the user acceptance. But languages, what languages is it going to be available in here in Northern Ireland? Because it's the Epic product's quite different where it's used in other parts of the world. So I'm just curious as to, have we done anything very specific for Northern Ireland?
No, yes, as you say, we can switch on translations into the available languages for my chart. We haven't done anything specific for Northern Ireland, and obviously the content that we're showing and the letters, we will be restricted to what is used by the professionals in the trust at the moment. We can follow up with a list of the languages. I think, I can't remember, Kate, if you know how many, but there are about, I'm going to say about 25 different languages that it's available in. I don't think the decision has been made yet, and I'm looking to colleagues to correct me if I'm wrong, to definitely switch on any of them yet. But that is still under consideration. In terms of other sorts of accessibility, just to say that the portal is devised for a reading age of around 8, and it's WCAG compliant, which would be a sort of worldwide standard, accessibility standard. Brian?
Yeah, I was on mute, sorry. Ella, you're correct. There has been discussion requests for Irish, Gaelic, Scot. Those will not be available to start with, but we are collecting a list of languages, and we are using kind of like the top languages used across Northern Ireland. So please, if there's additional languages, let us know, but we have been discussing and are aware of those.
Okay, thank you, Brian.
Can I just ask a question?
Yeah,
surely.
Hi, yeah, it's just hi. I'm from the physiotherapy team in Southeastern Trust, and there's just been talk around. We used a lot of patient exercise apps, which at the moment we send directly the exercises to patients just by email. And I suppose we would like to explore the possibility of being able to check compliance and stuff. And if it could all be done via my chart, it could be great. So it's just wondering whether that is something that's been considered about linking maybe other apps to it or other sort of programs to it that would all come in under that my chart for the likes of patient compliance of exercises and things. And
yeah, we have some flexibility there. There's been discussions for like patient surveys that are hosted by third-party vendors, and so we can point patients and service users to specific websites, URLs through the portal. If there's assessments or forms or smart, what do they call them? Smart tools. I'm thinking the Epic term, but if you've got like a watch or something that you want your data pushed directly, that's currently not enabled. But all those things, scales are another example where you can have your weight directly sent through. Those are features and functionalities that would be considered optimization. They're not part of our initial soft go live or soft rollout of this, but yeah, if there's specific websites, that's very easy for us to add those in. We're doing that for some patient satisfaction surveys as well.
Yeah, that's what I was going to ask, just about some specific outcome measures, validated outcome measures and stuff that we already routinely use that can be linked quite easily then as well.
Right, we would just need those from you, and then of course they would need to be vetted, but we're doing that for, I'll keep me honest here, I think it's 10,000 Voices and drawing a blank on the other, care opinion.
Yeah,
I think is the other one.
Yeah, for the experience type ones, those will be links out, but there are like prompts, questionnaires and things that we can build in. It's just
so they'll be built up within Encompass.
Where someone might not want their whole care team to know exactly what they put in is kind of linked out to a separate platform, whereas the sort of assessment tools and prompts can be built in, and we have built a large number into the assessments.
Okay, it's good to know. Thank you.
We have a question.
Can I just say a quick note? Sorry, I see more about care opinion. I just want to note there was some concerns when this was first brought up, and I want to rest those concerns if you all are thinking about it. Hopefully I'm not bringing something up, but the reason that we're linking out to care opinion 10,000 Voices is because within my care it's not anonymous, right? So you can't submit a survey and have it linked to a patient's account but then not say who the patient was that responded to it. which is why we've not built it in Encompass itself. So it's, if you want to keep anonymity, we have to keep it to where we point them to the actual service that's providing that assessment, Care Opinion, 10,000 Voices. So we explored building those out, but the request was that we keep it anonymous. So that's why we're pointing it out to the actual website.
Just on that interface piece, we have another question around being able to take information in perhaps from a stroke patient to see their cardiac data from an Apple iPhone app directly to the portal. And that will come up in various guises. Is that something that has been explored and included and accepted?
I don't know, Brian, do you want to add any detail to this? I mean, it's certainly something that's possible in terms of the technology.
Right.
Okay.
I don't want to monopolize, I apologize, but to the smart tools is what I was referring to. Those are features that could be available, but they won't be part of our initial rollout. So keep sending, that we do other instances of my chart. I'm coming from the US, obviously, that is features and functionality that is available. But for right now, we're still working on like the foundational setup that we want for you all. So these are really great ideas, and it's great tools that we can enable at a future date.
Just checking the chat here. We've a query there about the use of data, and is the system future-proof to allow data query, machine learning, AI capability that could evolve rapidly in the next few years?
I'd say a lot more than paper. So no, I think there is a lot of caution about using AI on people's like personal health data. But I know, yeah, there is interest as well in where this could be used to benefit everyone. So no definite plans, but it's an area to watch. And just aware, Linda, there that Mr. Novak has had his hand up.
Oh, I can't see the full screen of everyone.
Yes.
Go ahead, ask your question.
Yes, I wanted to know, is the patient able to, through this application or website, communicate with someone from the services, or is it just one-way traffic of information to him?
Well, that is one of the things that's being discussed. There is a messaging feature where patients can message into the care team. It's not like just WhatsApp, so it would go to a pool. It would be a bit like the way you'd let patients maybe contact your secretary at the moment. But there is trepidation maybe about switching, and certainly won't be switched on across the board. It will be, the decisions will be taken on really a service by service basis, is my understanding. Neil Black's chairing the task and finish group that is sort of looking into the detail of that.
I'm asking, my question is because I've seen few of these patients' websites or applications, and some of them were very proud that they allow the patient to communicate with their consultant and whoever, which is completely inappropriate, I think, because we simply cannot come to work on Monday and deliver service of 70 messages. Yeah. I personally can imagine that there could be services where it would be appreciated, like, for example, IBD nurses or maybe diabetes nurses. I don't want to talk for them, but generally speaking, if we allow patients to communicate with clinicians, we would open the Pandora box, which we will never be able to close.
Yeah, and it's a valid concern and one that is shared by many of your colleagues, and also because our waiting lists are the way they are, that, there's a specific issue in Northern Ireland where there potentially would be just a lot of messages about where am I on the waiting list, rather than the way it would work in other Epic customer sites where it would maybe be used to allow patient-initiated follow-ups. It's like, I don't need to see you as a regular review patient, but do you think I need to come in? It's just not, we're probably not quite there yet. So yeah, those concerns are very much being heard, and we are treading very cautiously.
Ella, James Nelson here, can I add a brief comment, just in addition to your answer?
Yeah.
Is that okay? I think those concerns are well understood, but I think reassuringly, if I understand it correctly, even if an entire service is in a sense switched off for receiving messages from patients, if an individual clinician wishes to, they can initiate a message to a patient via the app and control whether or not they can respond, which I think is really quite helpful, because perhaps the whole service might feel like we can't just do this, but maybe there's a subset of patients that you think actually this could work quite well. So there is some flexibility in the configuration.
Thank you.
So Ella, at the start of your presentation, you did mention that you know, this is an additional change and it's a challenge, and eventually some of these things will come out. So we have been asked in the chat about what the pace of optimization for My Record is, and you know, how's that going to be managed? So for example, when will patients be able to schedule their own appointments, and who'll determine that?
Yeah, well, there will be governance groups set up within Encompass to help manage that. And we will, of course, have a wonderful team of field analysts still on site after go live. So people like Graham will still be here, and Clarendon Doc, and able to make the changes required. To be honest, I think the pace is going to be governed a lot by the clinical and operational appetite. I mean, the potential for enabling more self-scheduling is huge, but I think the trusts are absolutely right that we need to almost stabilize with the Encompass Go Live before we start really exploiting that functionality. So it's hard to tell at this point in time. I mean, there is comparative data from other trusts, other customer sites. I don't know if it's fair to put Kate O'Brien on the spot here about the sort of usage that UCLH have gone quite far and quite fast with their patient portal functionality. But like I say, there are decisions to be made. A lot of it is about how much different services and different trusts want to push some of this. And hopefully we will have the ability to respond in terms of the central team.
Okay. It'll be interesting to see the power of the patient at work on this one.
Absolutely.
We have also a query about if a patient doesn't have capacity for the portal, can somebody register on their behalf? And about daily records from residential regulated service, will this be accessible?
Okay, well, in terms of the capacity, yeah, there will be a route to set up, a couple of routes to set up proxy access to your record. I'm not quite sure in terms of the lack of capacity, the arrangements, but that is being considered, and there will be sort of consent and protections around that. Also, if you do have capacity and you have a MyChart record, you can make that decision yourself within your record to allow someone else that proxy access. Kate or Brian, do you want to add anything to that answer, or is that?
No, I think you are spot on. You can grant proxy access to carers, and you can remove it if you no longer want them to have access to it. We also have protections in place that prevent someone from signing up for a MyChart account on your behalf. Part of that is the reason why we're using NI Direct for the sign up process, to ensure that it's proper people accessing or requesting access or an account for you.
Okay, thanks. Sorry, Linda, what was the second part of the question? Oh, yeah.
Around information from like residential settings.
No, that's unlikely to be available. The non-trust residential settings and care services will not be initially using Encompass, so that information won't be available, would be my understanding.
Okay. Simana, you have your hand raised. Can I ask, do you still have a question that you want to ask?
Yeah, I'm just wondering the two things. Say, for example, I'm coming from the lab perspective and the results, okay? So lab results include a variety like biochemistry, which are simple, which have a reference intervals, arm ranges and all. Then it includes pathology, it includes genetics and all, which are complex reports as well. So can the patient exactly see what the clinician has, or there should be a separate results access, or how does it work? Like, the complex comments which come with lab results and asking for follow-up investigations, or sometimes asking to look to referral guidelines, or sometimes asking them this patient's need to be red flagged and needs an urgent CT, et cetera, et cetera. So the lab results come with various comments like that. So will the patient able to see exactly what the clinician says, or they should be modified for the patient to see, because that will open a worm of anxiety and et cetera in the patients. So is there a timeline when the patients will see these results, that is after a clinic appointment or something? Access, is it restricted? Because sometimes we do pre-clinic bloods. So should we stop doing it, because can the patients have a look at these blood results before they come to the clinic, or should they be seen after they come to the clinic? And what do they do with the lab comments? So if they get anxious, will the number of GP calls increase, or the lab calls increase?
Okay, I'm going to give a very simple answer for that, which is that patients will not see exactly the same as the clinician. It will be a subset of results, and yeah, there will be a delay. I'm going to throw it to Brian for the more complex answer around seeing the comments on the lab results.
Yeah, I'll speak to actually two pieces. So I think there was two good questions within there. Well, the whole question was good, not just two parts of it, but regarding the types of lab results, we have a table that we've vetted through our Doctors Advisory Council, our Nurses Advisory Council. I believe pharmacists were involved as well. So we've broken it into kind of your more benign lab results, sensitive results, cancer, genetic results, things like that. Within that table for results release, we've gone through and we've had appropriate sign off from different boards and councils to say, okay, for general lab results, we'll release them, automatically release them to MyCare 10 days after the appointment. I might be off on the days there. Sensitive results, they will not be automatically released. It'll be up to the provider to release those results. So there is that discussion that has been happening as far as the comments or what's included within what's released to MyCare or the patient portal. That is also kind of contingent upon the type of result it is. So more sensitive results, it may be more beneficial for the consultant to reach out to the patient in conjunction or in coordination with the results being released to MyCare. But generally, the comments are very patient friendly, and we kind of curate that based off discussions with our providers. I don't know if I gave, did that answer your questions?
No, it is fine that at least grossly we're aware that, but the only thing is who's going to decide what is a sensitive test and what is not a sensitive test, because any test can be sensitive. There's nothing called a cold test or a hot test.
Yep, great question. So the consultant or the provider has the discretion to, so even if we set something for an automatic release, they can say do not share with patient. So for sensitive tests, it could be on the ownership of the consultant to decide if it was something they didn't want pushed out. Beyond that, though, we've gone through with our different EFCDGs, which are focused content design groups, and work with them to help us know which should be considered sensitive or not.
Yeah, but would it not be a governance issue if I decide for this patient, because I feel some of my patients are quite anxious, so I decide no, they're not going to see the results till they come to the clinic. So if some incident occurs with this patient, the patient can use it at this doctor didn't want to share my results with me because he was afraid that he did something wrong. So would not governance issues not arise if you're not getting access, like equal access to all patients? That's what my query comes with the lab results is very like, should it be discussed with the patient first and then released, or how does it work? Because we cannot have that, okay, I'm not going to share this result with the patient. Some patient may be brave enough to take the cancer result as well, doctor, I want to know what's going wrong. And some of them will be too sensitive. So what is sensitive is very subjective. And if you don't release them, then they can question us on the basis of equal access to care or equal access. Everybody should have equal access. So which results can you hold and which not? Maybe I'm taking it too complex, but there are few doubts from the results point of view. I represent the labs. So I'm just wanted to, a lot of queries come from the results point of view, but I'm sure the task and finish group involves some of the lab physicians. That's what I want to, and it, especially histopathology and genetics carry a lot there, like sort of, a lot of implications from our side. So I just wanted to be sure that, there's somebody in that task and finish group which would identify these issues.
Okay, all very good points. And I think that, there is a lot of careful consideration that has been going into this and will need to be going into this going forward, but we will double check to make sure that that lab perspective is involved in that group. Take a follow up on that.
Okay, thanks for that response. And I'm sure we'll hear more about that one. We've another questions around teenagers. They maybe don't want their parents to have access to their medical records any longer, even though their parents might have set the access up for them, some time back. So how's that going to be managed? Can they remove them?
So I have put a comment in Ella there.
Well, Graham,
right,
you give
okay.
detail rather than my
Sorry, so I have put a comment in there. So essentially, anybody up when you hit 13, if you want access to your MyCare account and you're deemed to be competent, then you can get access to your MyCare account. If at any point there is a proxy on your account and you want them removed for whatever reason, you would then speak to your clinical professional. You would give the explanation of why you would want them removed. And at that point, then either for whatever reason, they would be removed and that would be recorded on the system, or they would not be removed. And if somebody is removed as proxy, it is a system-wide message, so that if that person then turns up somewhere requesting access to the account again, the initial reason of why they've been removed is there for everybody to see, or for the next clinician to go in and say, well, okay, well, this person has been rejected based on this. Does that help answer?
Okay. Thanks, Graham. I know that comes up in a number of forums as well, so good to hear it from you. Has anybody else any other questions? As always, the Encompass digital dispatches is always well attended with lots of interaction with over 100 people on today. We will have this recording available on the DHCNI website within a week or so, once we get it subtitled. I hope you all enjoy the rest of this glorious day. Next month's session is on the 7th of July, and it's around developing the digital specialist workforce. And I'm sure there's plenty of people on this call today who will be interested in that topic as well. It just remains for me to thank Ella and her great back-in team for fielding all the questions today. As always, an interesting and hot topic. So Brian, Graham and Kate, thank you very much for your input, and for everybody else who took the time out over a Friday lunchtime to participate and ask some very inquisitive questions. And I hope to see you all again in July.
Thanks, everyone.